He was recovering until he wasn't, and no one saw it coming. He had made it through surgery. His vitals were good. The nurses said he was stable, and the family started to breathe again. He's coming home soon, they said. He just needs a little rest. But then something changed. He stopped making eye contact. He asked the same question 3 times in 5 minutes. He couldn't remember what day it was. And by the time the doctors realized something was wrong, he was already fading. No heart attack, no stroke. Just a quiet slipping away like someone turning down the lights in a room no one thought to check. What happened? Delirium. A word that sounds small, but in the hospital setting, it can mean everything. According to a major review published in JAMA, older adults who experience delirium in the hospital are twice as likely to die after discharge, even if they seemed medically stable. Delirium isn't just being a little off. It's a sign the brain is in distress, and when we don't recognize it, the cost can be irreversible. So today, we're going to talk about what delirium really is, why it's so often missed, and most importantly, what you can do to protect someone you love. But first, let me ask, have you ever seen a loved one get worse mentally after being discharged from the hospital? Type yes or no in the comments. I read them all because your stories matter. Let's begin. Number 1. Delirium is not just confusion. It's a brain emergency. Ooh, let's pause for a moment because this word, delirium, gets misunderstood far too often. People think it means being confused, groggy, or a little out of it, but it's so much more than that. Delirium is a sudden disruption in how the brain works. It's not gradual. It doesn't build over years like Alzheimer's. It can happen overnight. In someone who was alert yesterday and suddenly lost today. Here's what makes it so dangerous. Delirium isn't just about thinking. It's about survival. When the brain goes into delirium, it's like the body's control center is sending out distress signals, the circuits that regulate awareness. Memory, movement, and even breathing all start to short circuit. In fact, some experts now call delirium the 6th vital sign in older patients, right alongside temperature, blood pressure, heart rate, breathing, and oxygen. Because when delirium shows up, it means something deeper is failing. Maybe an infection, maybe dehydration, maybe a medication reaction, maybe just the stress of being in a hospital bed under bright lights, surrounded by unfamiliar sounds. The problem is, delirium often gets brushed off. It's normal after surgery. He's just tired. She's just not herself today. But what research shows is crystal clear. According to the JAMA study we mentioned earlier, older adults with delirium are twice as likely to die after discharge, even if they had no obvious physical complications. That's not small. That's not optional. That's a warning from the brain. So what does this mean for you or someone you love? It means we need to treat mental status changes the same way we treat chest pain, with urgency, with attention, with respect. Have you ever seen someone suddenly not themselves in the hospital and felt unsure what to do? Tell me in the comments. Your insight could help another family recognize that moment and act faster. In the next part, we'll break down exactly why delirium increases the risk of death and what's really happening inside the brain when it goes quiet. Number 2, why delirium can be deadly. What's happening inside the brain? We've said that delirium is serious, but today I want to show you why. It's not just confusing, it's potentially deadly. Let's look beneath the surface. inside the brain of an older adult going through delirium. Because here's what we now know. Delirium doesn't just happen in the mind, it affects the entire body by way of the brain. 1. Delirium disrupts brain function at the cellular level. When delirium begins, the brain's chemical signals called neurotransmitters go out of balance. Acetylcholine, the chemical that helps us focus, drops. Dopamine, the one that stimulates thought and movement, spikes too high. This chemical chaos interrupts normal thinking, awareness, and memory. But it also increases stress in the brain's cells, especially in older adults with pre-existing inflammation or damage. Over time, that stress adds up, leading to what doctors call acute brain failure. 2. Delirium triggers a chain reaction in the whole body. The brain controls everything: heart rhythm, breathing, digestion, hormones. When the brain gets confused, the body begins to misfire. Heart rate becomes erratic. Blood pressure fluctuates. The immune system overreacts. And the body enters a state of metabolic stress. In this state, even a small infection or minor surgery can turn fatal, especially in a system already weakened by age or illness. 3. Delirium leads to immobility, and immobility kills. When someone is confused, they stop moving. They lie still. They don't eat well. They become disoriented, dehydrated, and more vulnerable to bed sores, infections, blood clots, and pneumonia. The body begins to shut down slowly, but surely. This is why, as the JAMA study found, delirium doubles the risk of death after discharge even if the person seemed physically fine. Because underneath the surface, the brain had already begun losing its grip. So what does this mean for you? It means the moment you see delirium, you don't just watch, you act. Delirium isn't a wait-and-see situation. It's the brain saying, I'm struggling. And like chest pain or shortness of breath, it deserves urgent attention. Have you ever thought confusion could be this serious? Tell me in the comments yes or I didn't know. Because what we know now could save someone tomorrow. In the next part, I'll explain why delirium so often gets missed, even in good hospitals, and how you can help doctors and nurses catch it earlier. Number 3, why delirium often gets missed, even in the best hospitals. It's a painful truth, but one we have to face if we want to protect our loved ones. Delirium is often missed, not because people don't care, not because doctors or nurses aren't doing their job, but because delirium is complex. It hides, it shifts, and it doesn't always look the way we expect. Let's break down why this happens so we can do better. 1. Delirium isn't constant. Unlike a broken bone or a fever, delirium can come and go. Someone may be confused in the morning and seem perfectly fine by afternoon. That fluctuation can trick even trained professionals into thinking nothing is wrong. 2, it mimics other conditions. Delirium can look like dementia. It can resemble anxiety, depression, or medication side effects. When symptoms overlap, it becomes hard to pinpoint what's really causing the change. 3, it's not always documented. Hospitals are busy, staff rotate, shifts change. What one nurse notices in the evening might not get passed to the morning team. Subtle signs like slowed speech, confusion, or withdrawn behavior can be lost in the shuffle. 4, we normalize confusion in older adults. Many people still believe that it's normal for older patients to be disoriented in the hospital. They assume it's age, fatigue, or just stress. This belief can delay urgent care when the brain is, in fact, in crisis. So how can families help to pay attention to small changes in behavior? Speak up, even if it feels uncomfortable. Use specific phrases. She's not acting like herself today. Ask the question directly. Could this be delirium? You don't need to have a medical degree to protect someone. You just need to notice, then say something. Delirium is reversible, but only if we recognize it in time. Have you ever felt unsure about how to raise a concern in a hospital setting? Comment yes or not sure below. Let's support each other in learning how to speak up with calm confidence. In the next part, I'll show you how to prepare at home to reduce the chances of delirium before someone even enters the hospital. Because prevention begins before the crisis. Number 4. How to prepare before hospitalization to lower delirium. Risk. Delirium doesn't always begin in the hospital. Often, it starts before the first IV is placed in the days, even weeks, leading up to admission. That's why prevention begins at home. When we strengthen the body and calm the brain before a hospital stay, we give the mind a better chance to stay clear and steady no matter the medical challenge ahead. Here are the core areas to focus on. 1. Hydration. Dehydration is one of the most common and preventable causes of delirium. Older adults often don't feel thirsty, so it's easy for fluid levels to drop quietly. What to do? Drink water consistently throughout the day. Reduce dehydrating drinks like soda or alcohol. Monitor urine color. Pale yellow is a good sign. 2. Sleep regulation. Sleep cycles are delicate, especially for the aging brain. Disrupted sleep before hospitalization increases risk of confusion during the stay. What to do? Go to bed and wake up at the same time every day. Avoid screens at night. Keep the room dark, cool, and quiet. 3. Medication review. Some prescriptions or over-the-counter medications may increase delirium risk. This includes sedatives, anticholinergics, and certain pain relievers. What to do? Create a complete medication list. Review it with your doctor or pharmacist. Ask specifically, are any of these known to cause confusion in older adults? 4. Mental orientation and routine. A strong daily rhythm helps the brain feel safe. Losing that rhythm, especially in a hospital, can disorient the mind quickly. What to do? Keep a consistent routine: meals, light exercise, and social interaction. Use calendars, clocks, and reminders daily. Stimulate the mind with music, reading, or light conversation. 5. Sensory support. Hearing or vision loss increases confusion during hospitalization. Agree, the brain needs clear input to stay grounded. What to do? Bring hearing aids and glasses to the hospital. Label personal items clearly. Use soft lighting at home in the days before admission. These are small actions, but they create a strong foundation for mental stability. Preventing delirium isn't about doing everything perfectly. It's about preparing wisely and gently so the brain can stay anchored, even when the body is vulnerable. Which of these steps are part of your daily routine? Leave a comment below and let me know which one you're planning to start this week. In the next section, I'll walk you through how to care for someone if delirium does appear and how to protect their dignity, their safety, and their mind. Number 5, how to care for someone during delirium without adding to their fear. When delirium sets in, it can feel overwhelming. There's confusion, fear, disconnection. Sometimes the person seems like a stranger, but behind the agitation, behind the silence, there is still a mind trying to find safety. And what you do at that moment matters more than you think. Here's how to care with both compassion and clarity. 1. Stay calm and present. Delirium is confusing for the person and for those around them. but your calm voice, your steady presence, can become their anchor. Speak slowly. Use a soft tone. Repeat gently when needed. Let them know they are not alone. 2. Maintain a simple, quiet environment. The brain in delirium is highly sensitive to light, noise, and disruption. Avoid crowded rooms. Reduce background noise. Use familiar objects, soft lighting, and a consistent setting to reduce confusion. 3. Reorient with kindness. Gently remind them of the day, time, and location. Use a clock, calendar, or window view. Avoid arguments or corrections. Focus on connection, not correction. 4. Support basic needs regularly. Delirium worsens with hunger, thirst, immobility, or constipation. Encourage small meals, hydration, safe movement, and toileting. Keep routines as stable as possible. 5. Limit physical restraints unless absolutely necessary. Being tied down or overly restricted can increase panic and prolong delirium. Prioritize safety, but also dignity. Use calm supervision instead of force when possible. 6. Communicate with medical staff clearly. Share what you've observed. He hasn't recognized me since yesterday. She's been more agitated at night. Ask directly, is this being monitored as delirium? Your voice is part of their care. Delirium isn't easy, but it is survivable. And the way we respond can shape not only recovery, but emotional trust for years to come. Have you ever supported someone through confusion or mental distress? Leave a yes or learning in the comments. This is a place where knowledge meets compassion. In the final section, we'll bring everything together and share one healing message for every family facing the silent storm of delirium. After the confusion clears, depression often moves in Don't Let It Stay Silent. You've stayed with me through a tough conversation, one that many families don't even realize they need until it's too late. We've talked about delirium, what it looks like, how to respond, how to protect a brain in crisis. But there's one more truth we can't leave unspoken. After delirium ends, depression often begins. According to the National Institute on Aging, older adults who experience delirium are at significantly higher risk for developing clinical depression, especially in the weeks and months following hospitalization. Why? Because the brain doesn't just bounce back. It remembers the disorientation. It holds the fear, the confusion, the loss of control. And when the body begins to heal, the spirit may still feel broken. Depression in older adults is not just being sad or feeling down. It can show up as fatigue, withdrawal, poor appetite, or sleep changes. And it is too often mistaken for aging, but it's not aging. It's treatable. And it deserves attention just like delirium did. So as we close this chapter, I want to leave you with one message. Protecting the mind means more than surviving a crisis. It means creating space for emotional recovery too. In our next video, we'll talk about depression in the elderly, how to spot the subtle signs, how to tell the difference between normal aging and a treatable illness, and how to bring light back into the lives of those who feel lost. If that sounds like something your family needs, please subscribe. And comment below. Have you ever seen a loved one go quiet after a hospital stay? Your story might help others feel less alone. Thank you for walking through this with me. I hope this video gave you not just knowledge, but the strength to act with love and the peace of knowing you are not alone.